Hi, I'm Megan. I'm here to do my sinus trigger. I already have the tube detented and set at 40 inches. I have a DR plate in there so I don't have to switch out the plate every time. And I'm going to get my patient. Irene?
Yes.
Hello.
Hello.
How are you today?
I'm wonderful.
That's good. Can you tell me your full name?
Irene Abad,
And your date of birth?
3/13/61.
And is there any chance you're pregnant?
No.
Alright. And so why are you here today?
Sinus
Okay.
pressure.
Sinus pressure? Okay, so I'm gonna position you. Well, first, so I'm gonna have you remove any metal or jewelry or any metal hairpins. So no metal in there. Alright, you removed your earrings. Everything is good. So I'm going to position you over here. So I'm gonna have you come stand over here, facing that wall. So the first one I'm gonna do is the lateral sinus.
Okay.
So I'm going to actually have you kind of facing the board and turning your head to the right. Yeah. Alright, move this up. So the central ray enters 1 inch posterior to the EAM, or to the outer canthus. So turn your head that way. And now you take a little step back and to your left. Alright. Just coning in to get the sinuses. And my left marker will go over there. Alright, a little bit closer to the board. And to your head here. Perfect. Okay, so the IOML is going to be parallel with the IR. And she's going to have suspended breathing. Throughout all of them, she's been wearing this shield. So I'll just ask her to hold her breath, take an x-ray, and then you can breathe. The technique I used for that one is 70 at 8. And for the next one, I'm going to do the PA axial Caldwell. So I'm going to have you turn and face the board. So because it's a sinus, it's not really an axial then, since it's a horizontal beam. But they're all horizontal beams, so they can show the fluid level in the sinuses. So you're gonna step closer. The central ray is going to be exiting the nasion. Try to get your head down a little bit. And then there should be a 15-degree angle between the OML and the central ray. This one I'll do at 75 at 10. Cone in a little, and then my left marker here. Alright, so I'll hold nice and still. Throughout all of them, she's been wearing this shield. And I'll have her hold her breath again, take the x-ray, you can breathe. The next one I'm going to do is the parieto-canthal waters view. So that means the central ray is entering the parietal bone, exiting the canthion. So you're going to tilt your head back. The MML is perpendicular with the plate. So you're going to put your chin up on the board. Okay, so that is perpendicular. And the OML creates a 37-degree angle with the IR. And I'm going to have right there. I have my left marker back here. Alright. This way. Perfect. And for this one, I'll do 75 at 20. Throughout all of them, she's been wearing this shield. So the same thing, have her hold her breath, x-ray, you can breathe. And the last one I'm going to do is the SMV, so I'll have you turn around. And put your back up against the board. Okay, so, sorry. have you take a little step forward. And then for this one, you're going to put your head back against the board. Yeah. So, take a tiny step back. Yep. So head is back up against the board. I'm going to move this down a little. So the central ray enters 3/4 of an inch anterior to the EAM, and then the IOML is parallel with the board. So, nice and centered. Cone in. I'll put my right marker up and have her hold still real fast. Throughout all of them, she's been wearing this shield. So, you're going to hold your breath, x-ray, you can breathe and relax. And this one's going to be done at 75 at 20. And obviously throughout all of them, she's been wearing this shield. So for the lateral sinuses, all 4 sinuses should be seen, but the sphenoidal sinus is of primary importance. There should be no rotation, which can be seen by the sella turcica. There should be superimposed orbital roofs, superimposed mandibular rami, clearly visible sinuses, close beam restriction, which you can see it's collimated well, and clearly visible air fluid levels if present. For the PA axial Caldwell method, there should be equal distance between the lateral border of the skull and the lateral border of the orbits, indicating no rotation, equal on both sides. The petrous ridges should be symmetric on both sides, and they should be lying in the lower third of the orbit. The frontal sinus, it's hard to see, should be lying above the frontonasal suture, and the anterior ethmoidal air cells lying above the petrous ridges. The frontal and anterior ethmoidal air cells can be seen, clearly visible air fluid levels if present, and close collimation. For the parieto-canthal waters view, the petrous pyramids should be lying immediately inferior to the floor of the maxillary sinuses. The orbits and maxillary sinuses are symmetric on each side. There should be able to clearly see the maxillary sinuses. Close beam restriction of the sinus area, which you can tell it's collimated nicely, and clearly visible air fluid levels if present. For the SMV of the sinuses, there should be equal distance from the lateral border of the skull to the mandibular condyles on each side, indicating that the mid-sagittal plane is perpendicular and there's no tilt. Anterior frontal bone superimposed by the mental protuberance, indicating that the IOML is parallel. The mandibular condyles anterior to the petrous pyramids, and there should be clearly visible air fluid levels if present.